Hello, future nurses. My name is Maribel Leyva, and I will be showing you today step by step on how to insert and remove an IV. So let's get started. First, you want to gather all your supplies. You will need your IV starter kit, your normal saline flush, your IV extension, and your gauge. Choosing a suitable gauge catheter for the situation. So, in general, for IVs, you will need a catheter that's about 14 to 24 gauge. 10 towards higher gauge, thinner catheters for children and the elderly, but 10 towards the lower gauge, thicker catheters when rapid transfusion is needed. As you can see in the slide, there's all different types. It ranges from 14 to 24. 24 being the smallest and 14 being the thickest. So after you've gathered your supplies, you will go and stand, before you go inside the room, you will stand outside the door, you will verify provider's orders, verify care plan, you will maintain standard precautions, and then you will knock on the door. Once you go in, you will provide patient privacy, you will perform hand hygiene, and you will introduce yourself and your title. This is a critical part, is to identify patient with name and date of birth. You want to make sure you have the correct patient, and you also want to assess for allergies. You will also want to perform caring behaviors. Examples of caring behaviors are therapeutic communication, shaking your patient's hand, involving your patient in the procedure, and reassurance. Also note that touch and eye contact is not the same for all cultures. You will then want to explain the procedure to your patient. Talking to your patient and sharing the basic information helps put them at ease and ensures that no part of the process surprises or shocks them. You will tell your patient that the doctor has ordered an insertion of an IV of sodium chloride. That's what we're going to be demonstrating today. Inform your patient that cannulation may cause some discomfort. Then you want to go ahead and prep and prime your tubing. Just like in the slide, you will have your saline bag and your tubing. Where I have it circled, it says to make sure to clean the spike before you insert it into the saline bag. We don't want to contaminate the saline bag because it's going to go into the bloodstream. Also, be sure to remove any air bubbles from the tubing by gently tabbing or squeezing or flushing them out of the line. Injecting air bubbles into the patient's bloodstream can cause a serious condition called an embolism, and we don't want that. One easy technique for removing air bubbles from the IV tubing is to uncoil the tubing to its full length and to run the roller valve all the way to the drip chamber. And then you will open the valve and release the line fluid. That should flow down the length of the tubing without producing any bubbles. You also want to go ahead and date and initials your bag and the IV tubing. This is very important because we need to know when it expires, when we need to do the retubing, and it's for the incoming nurse as well. Next, you will see a quick video demonstration of how to insert an IV cannula. Okay, once you have verified the order, you have explained everything to the patient, explained the procedure, you have to make sure that you have the right patient, verify name and date of birth. We need 2 verifiers, and if there's any allergies. So right now we're going to be inserting the IV cannula. Make sure you have all your supplies. So the first thing you're going to have is all your supplies will include we're going to do the demonstration with a 22 IV gauge needle. And then we will have a saline flush to prime the line and to ensure it's patent. An IV extension tubing connects to the cannula IV starter kit, a tourniquet, which includes the tourniquet, tape, AC, alcohol, prep pads, and make sure you have a pair of gloves. So prior to having your pair of gloves, you're going to wash your hands, and then you will put on your gloves. So once we get started, we will first need to prime our tubing so we can have it ready once we start the IV cannula. So with the priming the tubing, you're going to go ahead and get your saline, and you're going to get the bubble out of the saline. Okay, all right, like that. And once you get the bubble out of your saline, be careful not to contaminate it. Open up your IV extension, and then you're going to put it in to your saline. It's gonna like a twist, just like that. Without contaminating or touching, we're going to make sure that it is flushed and that all the air is out. So we're going to run the saline through, and once you see the drip, it is good to go. So we will put it back into the packaging without contaminating, not touching anything. Back into its packaging, and then we will put it back into the packaging and set it to the side. So then we're going to apply the tourniquet. Come on, let's do the tourniquet. Okay, so this is going to be a minimum of 2 minutes. So apply the tourniquet just like that. Go ahead down a little bit. Go down, and then you're going to go ahead and do the dominant hand twist for the quick release and go like that. So there's many different ways to put it. We're going to put it in the antecubital, but there's also the forearm and the dorsal of the hand. So once you have your tourniquet on, you're going to have your patient pump the fist. So once you find your vein, you're going to go ahead and clean the sites with your alcohol prep pad. To clean the site, you're going to do it in a circular motion for about 10 to 15 seconds. Make sure you don't leave the tourniquet on for more than 2 minutes. Once you clean for about 10 to 15 seconds to get all the bacteria, all the germs off, you're going to go ahead and insert your cannula. So you're going to go ahead and put it in just like that. Once it's in, you're going to go ahead and once you see blood in the chamber, you're going to go ahead and release it. Put your thumb on it and release it back all the way out, and you're going to go ahead and dispose it. Put pressure with your thumb. Make sure you keep the pressure on there so we don't lose it. And then you're going to go ahead and after you take the needle out and you dispose it, you're going to go ahead and grab your saline and make sure you don't contaminate it. So you're going to go ahead and insert your saline. You're going to twist it just like that, the saline. And then you're going to go ahead and pump the saline through. And you're going to look for puffiness on the side. If it starts to puff up, that's a bad sign. That means your IV is infiltrated and the saline is going to the tissues and not the vein. So take out the vein and do a new IV. So once you do that, you make sure you take out the tourniquet, and then you do the whole IV, you do the whole saline. If the patient says that she feels coolness, then it is in the right place, and they can taste it. Once you do the whole saline, you are going to tape it down. So you're going to do the butterfly method, and it's tape under the wings and crisscross over. Okay, so once you go ahead and take that down, you're going to get your Tegaderm and you're going to place it right there, and you're going to label it with the initials, date, and the gauge size, and then you will go ahead and connect the IV tubing with the saline lock, and you're going to go ahead and connect it just like that and start your IV. And that is inserting your IV. An IV push or a bolus is a rapid injection of medication. A syringe is inserted into your catheter to send one-time dose of drug into your bloodstream. An IV piggyback or a secondary infusion is the administration of medication that is diluted in a small volume of IV solution through a primary infusion, just as the picture shows below. So now the doctor has ordered to remove the IV catheter. the IV discontinuation. So what you will do is you will do just the same thing as you would with your insertion of verifying provider's orders, verifying care plan, maintaining standard precautions, and then you will knock on the door. You will provide patient privacy, hand hygiene, and then you'll introduce yourself and you will self-entitle, and then you will verify their name and date of birth to make sure you have the correct patient and ask for allergies. You will explain the procedure to the patient that it's time to take out your IV, and then you will go ahead and go on with the procedure. You will grab some gauze and put your gloves on, perform hand hygiene and put your gloves on, and grab the gauze and go ahead and put pressure. You will hold the IV tubing with your dominant hand. Use the other hand to clamp the tubing, how it shows in the picture. Put pressure on the site, and if possible, raise the arm so that IV site is above the level of the heart. Hold pressure until the bleeding has stopped, and then you will remove the catheter. Make sure to inspect for the intactness. It's all there, and you didn't leave anything behind. Then you will dispose the fluid bag and the tubing accordingly to facility policy and into the appropriate disposal receptacle. So after you're done, you inform your patient that you are done, and if they need anything else or if they have any questions or concerns. You will hand the call light to the patient. You will then lower the bed to the lowest position, put the bed rails up, and you will advise your patient that you will return in 30 minutes. You will perform hand hygiene, and you will dispose of PPE and used equipment. Thank you.